I'm going to move that off. Hi, my name is Pam Caber. I am a family nurse practitioner at Rocky Mountain University. I am obtaining my post mental health certificate, and this is for the DNP 630 class. And I'm interviewing a fellow classmate named Michelle St. John, and she's also a family nurse practitioner who is obtaining her post mental health certificate at Rocky Mountain University. And I have her on the phone right now. You can introduce yourself, Michelle.
Hi, I'm Michelle St. John, and as you said, I am a family nurse practitioner, and I work part-time in a home health setting. I go into members' houses and do annual health risk assessments for insurance companies, which consists of a annual physical, basically. And with that, we do some screening tests. I provide spirometry, DNP, or DPN, testing for peripheral neuropathy, and some other diagnostic tests to support some diagnoses for these members for their health plan.
And
go
ahead.
In our office, we don't really have a collaborative situation other than should we find a problem with one of our members, we contact case management, and then case management does all follow-up and refers the member back to their primary care for any continued follow-up care.
All right, so you don't work with any physician, you don't have physicians down there that you work with. It's the case managers and stuff like that.
Yeah, so in Florida, we do have to have a collaborating physician.
Right.
To practice, and so we do have a collaborating physician that oversees the practice, but no, we don't directly contact them for any reasons. If we find a problem when we're assessing the patients, or we go ahead and contact their primary care.
Okay. And how long have you been a nurse practitioner?
6 years.
Oh, okay.
So yeah, I started 6 years ago, and I did a little bit of time in an office, and I didn't really enjoy that. I didn't like the 10-minute turnaround. I didn't feel like I got enough time with my patients, and I didn't really enjoy that setting.
Yeah.
So this opportunity gives me about 60 minutes to spend a lot of time educating and working with these individuals.
Oh, that sounds nice. Next question. If you think back to when you first started practicing as an NP, what was one or two of the biggest struggles you face as you transitioned from an RN to an NP?
I think it was actually before I started to get a job. I had just finished school, and I was still working as an RN in the emergency room. And I just remember we had a patient come in, and I wasn't happy with the way the care was going, and talked to the PA that was taking care of them. And I did get a little pushback from the PA that was like, "Oh, aren't you smarty pants now that you went to school?" And I was like, "Yeah, well, would you humor me and just run this test?" And I'm not going to brag, but it turns out I was right.
Yeah, you can brag. It's all right.
Yeah, but I think it was hard in that environment. That now that I was still kind of working as an RN because I hadn't quite got a job as a nurse practitioner, and so I was trying to still keep that job. The transition was a little bit difficult because you know a lot more, you want to see more done, but you're still kind of restricted. And so I found that I kind of quickly left that situation.
Yeah, it does make it hard.
And moved on. Yeah.
Yeah, I understand that one too. As a FNP too, I understand that. Next question would be to consider your scope of practice and regulatory bodies within your state. Do you agree with the regulations of your licensure designated by the state, which would be Florida?
Yeah, so Florida is definitely one of falls under the red category of restrictive. It was the last to get DEA availability here, and it was hard fought to get just the ability to write for controlled substances. We have a very strong medical association here that fights tooth and nail to kind of keep hold of their piece of the pie, and they've blocked a lot of legislature that would allow nurse practitioners some advancement. So I think we're not practicing even close to our full scope of practice here in Florida. However, that being said, there is a House bill on the floor right now to push forward independent practice for nurse practitioners. So if that passes, which it actually has grown some legs and moved through to the next session. So I don't have particularly high hopes that it'll pass this time, but surprising things happen. But there's such a dire need for access of care, especially here in Florida. Well, I guess across the country. But so if we could, get independent practice, I think we wouldn't be taking away anything from the physicians and the primary cares. I think we would just be benefiting, the residents. So I would love to see that, and I would love to see, even if we had to do it in a tiered fashion, where maybe you have to start off with a collaborating physician for a certain number of years, and then move on to a different level of collaboration until you've achieved a level of competency that would allow for independent practice. Even if it had to be a baby step kind of approach, but certainly make a pathway to get us there.
Yeah, I think that's a great idea.
At some point, we have to keep up with what the times are doing across the country. And certainly, like the VA here is in Florida, and they have independent practice nurse practitioners. So it's happening here in Florida on VA properties, but
right.
Not but. So it's not unheard of, and we all know, as nurse practitioners in this field, when you look at the statistics, the nurse practitioners are not the one. Here in Florida, the opioid crisis we went through, well, that all happened during a period of time when nurse practitioners were not allowed to write for narcotics.
Right.
So it wasn't the nurse practitioners that created the opioid crisis.
That's the truth.
The doctors.
Right.
So we're not the ones that are, not practicing good medicine, and the studies show that that's the case. We're practicing, good medicine. We're providing high quality care, and patient satisfactions are high. So
and it's safe. I think
kind of unleash us would be the best thing for the state.
Well, that's good. And I think you answered the next question also, which is, are there any changes you would make with the credentialing and clinical privileges? Just what we were talking about. So I think we covered.
Definitely.
Yeah. So the next one would be, do you consider yourself working in a collaborative practice? So you would probably say yes for that one too, right?
We collaborate, like I said, collaborate a little bit with the case management. Unfortunately, it's kind of a one-way. To where I am now, I kind of pass off the information, but I don't really get anything back.
Okay.
So I'm not sure if you would consider that true collaboration. Unfortunately, the care that I give now is like a one-time visit. I don't see the patients more than once a year.
Okay.
So other than just that one-time collaboration, whether it's with their case manager or with their PCP, if I find something pressing, urgent that needs addressing. So not within my practice, but I do collaborate with others as necessary.
Okay. And you probably say maybe once a week, or once every so many weeks that you do that, or once a month for to meet with?
Yeah, no, I don't really meet with them. Only like via email if I have a
Okay.
problem with the patient, or if I'm at a home and there's an issue, I call the doctor, and that's maybe once a month.
Okay. Before we get into the psych ones, can you provide a clinical scenario where you sought clinical consult with another professional and how it helped with your patient's outcome?
Oh, there's these home visits are definitely required. Sometimes we have to, when I call their PCP, and I'll have them, I'll tell them what's going on with the patient that particular day, and they may say, okay, well, I'm going to call them in this medication, because I'll get there and their blood sugars have been running high, and I have the ability to look at their monitor and go through and read their monitor. And so I can call and say, hey, Mr. Smith had, a month's worth of, 305s, 307s,
Right.
and I just did a A1C, and it's, 8.5. Do you want to adjust his medications? And, that's when the doctor may say, oh, what's he taking? Is he compliant? Yes. Okay, well, let's go ahead and adjust it to this and have him schedule a follow-up with me next week.
Okay.
So I do run into that scenario.
Okay. The next ones are actually for your schooling that we're doing right now. So what made you choose to complete your post-mental health certificate since you're already a family nurse practitioner?
So you asked me how long I've been a nurse practitioner. 6 years, but I've been a paramedic for about 22, and I've worked in the fire department as a paramedic for 20. So I've done a lot of clinical hands-on patient care, and I was kind of ready to step away from that. And there's a crisis of mental health issues amongst first responders. The suicide rate is higher amongst first responders than any other profession, and they're dying. The more first responders are dying from suicide than actual line of duty deaths across the country. So I sat back and I thought about, what I want to do when I retired from the fire department, and going back to full-time, clinical nurse practitioner work wasn't really what I was thinking of doing, and I've personally been affected by, firefighters that have taken their own lives because of the job, and I thought, I think that's something I could help with. So I decided that would be where I'd like to go in the future. So I decided to get this postmaster certification, and I think the specialty where I'd like to go with that. I think this is your next question.
Yep.
If I'd had to guess.
That's all right. Where do you plan on working? Yep, that was my next question.
Yeah. So there's a huge gap in care for first responders when it comes to mental health. I can tell you of an incident here where we had a particularly bad call, and some of the first responders, firefighters, were sent to see, the employee assistance program, the EAP counselor. And about halfway through the session, if it took that long, the counselor, stood up, was crying, and said, "I can't do this."
Oh my.
Was not capable of handling the situation that the firefighters had gone through and needed to talk out. Just couldn't take it, couldn't handle it. Because if you think about it, some of the things we see are horrific.
That's horrific.
And so I thought about that, and I've done a lot of education and teaching as part of my job with the county and where I work and stuff like that. And I thought, I think that that would be something that would be beneficial. These guys would be able to, talk to me knowing that I've seen it.
Right.
So they're not gonna, they can share whatever they need to with me, and that I've lived it. And there's something that is a sense of relief that comes where you can be totally honest with somebody, because you're not going to say something that could offend them or could shock them, because more than likely, they've experienced it. So I thought, well, I think that could be something I could really do to help my brother and sister firefighters and law enforcement and when I retire. So that's kind of where I plan to focus when I get my certification.
Well, good for you. I think you're going to do great. So,
thanks.
Oh, you're very welcome. And thank you for everything you do. I think that was my last question. So, and I greatly appreciate your time doing this. And
no problem.
So that will be the end of my video. Thank you so much, Michelle.
Perfect.
Bye-bye.